Our practice was founded actually on a prepaid basis, and so our culture really right from the start emphasized the notion that we would take care of large groups, populations of patients, and do so in a prepaid fashion, which is in fact global payment. I think over the years that's been an attractive model for a lot of our physicians, to be able to come to a practice where they could practice medicine in an unfettered way under a system that supported them in taking care of a population of patients. I don't think you can do global payment with very small groups with very small numbers of patients. That's how a lot of physicians got burnt in the 80s and 90s. They took on responsibilities and commitments that it's impossible to be responsible for, frankly. So first of all, it has to be a large enough entity. No 2 or 3 person practice should be doing this on their own, and I don't think that was ever the expectation. I think, secondly, you have to think about it as a journey. It's not something that you would, if you have no experience in doing this, that you would necessarily sign up for, for January 1st, 2010. I think the Payment Reform Commission outlined that they think, and I think we're supportive of that, frankly, that it can be done over a 5-year period for a large number of patients in this Commonwealth, but it is going to take several steps to get there. I think thirdly, I would say that if you lay out a plan in terms of how you're going to identify who your patients are, if you do some benchmarking around what are the practices that have been successful. Look around. There's actually a lot of experience in this state with practices like Atrius Health, like Fallon Clinic, who have large amounts of global payment that, call them, go there, see how it's done, enter into it in a staged fashion, and I think it's a process, but it's definitely doable. There's a culture of fee-for-service, right? The culture of fee-for-service is the more patients you see, the more services you provide, the more income and more direct benefit you receive. What's required under global payment is a different culture that is really more focused on how to provide the best care for the patient, which I think everybody wants to do regardless of payment system, but doing it in a way that's evidence-based, that is thinking about the big picture as well as the patient in front of you, and thinking of how to care for not just the patient in the exam room, but a population of patients. And that's really a paradigm shift, because I think most physicians grow up and are trained in a way where the way we think of delivering care is in that visit, in that one-on-one in the exam room. And it certainly continues to this day to be an important aspect of how we deliver care. Under global payment, you can actually provide services and care that you can't get under a fee-for-service system. And what we find is that when patients leave us and they experience a sort of more open-ended kind of see a specialist, get your care in various places in a random kind of way, they come back and they say, you know what, when I got my care here, I saw you all the time. I knew what kind of care I was getting. It always seemed to be there for me. So we can provide services, as I mentioned earlier, like health coaches, like case managers. We can do outreach. We can stay in touch with our patients. And they ultimately can get services that they can't get otherwise. So an example is, services through the internet, being able to email their doctors. In a fee-for-service model, that's not sort of frowned upon because it's not a revenue generator, it takes time. In a global payment model, it's actually a good thing, as are e-visits. So patients can access us in different ways, either our team, the physician, through the internet, in ways that make sense. I think that global payment addresses probably not every need society has around healthcare, but for a large segment of the population that receives its care in its community with primary care providers and specialties and hospitals, which is sort of the way we're set up. For large numbers, I think it makes sense.